This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
Sensodyne, #1 dentist recommended brand for sensitive teeth.
Did you know? Some research reveals that there are 4.8 billion mobile users, but only 4.2 billion people with a toothbrush. Shocking, because the right toothbrush is essential to your dental health.
Now, the question I always ask myself is, how do you go about choosing the right kind of toothbrush? Is it the pink one? Is it the blue one? The one with the spikes, or the one that makes your mouth go blablabla? Well, periodontist Dr. Howard Gluckman is here to give us some advice. Now, Doc, I must say the last few weeks of talking about dental care have really inspired me to take on a different viewpoint when it comes to oral care. But it, of course, all starts with brushing your teeth. So how do I go about picking the perfect toothbrush?
Well, I think there are a couple of rules that one must follow with regards to choosing the right toothbrush. The first one is the type of bristle, and the second one is the size of the head. Now, a lot of people will think that the bigger the toothbrush, the better, because they can brush their teeth faster, and that's certainly the wrong way to go. Because the bigger the head, the more difficult it is to get into all the little nooks and crannies, and that's really what it's about. Because most patients feel that they just give it a good quick scrub and everything's fine. But what we don't realize is that there are lots of little hiding places for bacteria to get to, and if we aren't very fastidious about brushing into those little nooks and crannies, we're not actually going to do the job properly. I get it often where a patient says, "Yes, doc, I've just brushed. I've just given myself a good old scrub and I flossed." And you go inside and there's plaque all over the place. You can see the places that they have brushed, but they've actually left out a lot of those areas. And if you'll find, if you've got a smaller brush head, it is far easier to get into those areas and to clean effectively with a smaller brush head. It doesn't have to be minute. It should be one that just covers around 1 to 1.5 teeth. And that's all that's adequate, okay? And that will get you to those areas. The second thing, as we mentioned, is the bristles. Now, there's a misconception that the harder you brush and the harder your bristles, the cleaner your teeth, because you've got that beautiful, that glassy feeling that you have. But essentially, plaque is very, very soft, and it doesn't require a hard bristle to clean it off. In fact, the harder the bristle, the more damage you will do. The more you will damage the gums and cause gum recession, the more you will cause opening up of the little tubules in your dentine and increase the sensitivity of the teeth. So you want something that's fairly soft, that's nicely polished, and that will not do any damage.
And how often should I be replacing my toothbrush?
That is a very good question. And again, it's really horses for courses in that sort of situation, because if you have somebody who really does brush hard, they're going to have to replace their toothbrush far more often. But as a rule, one would generally look at around 3 months. But again, it does come down to how aggressively you brush your teeth. And I think what one should look at is, one should look at the bristles. Are the bristles still nice and straight? Are they all splayed out? The minute you start seeing the bristles splaying out, they are not working effectively. You're now brushing with the side of the bristle rather than the top of the bristle. And you want to be as effective as you can. So if you find that within a month they're starting to splay, there's 2 things you need to look at. Number 1, you're brushing too hard. And we've spoken about hard brushing. You need to be a little bit kinder to yourself. Go easy. The second thing is that you should be replacing it more often.
And of course, as always, flossing most important, right?
Flossing is absolutely critical. One has to make sure that you eliminate all the plaque from between the teeth. Plaque is something, and decay and gum disease is something that starts between the teeth. So if you are not flossing, you are not getting rid of the plaque and the bacteria, which are in the areas that cause the most disease in your mouth.
So the most important thing to remember, prevention is better than cure. So always go for your regular dental checkups and consult your dental practitioner.